Dear students, welcome back. Now in this session we are going to discuss about the skeleton of foot and the articulations of the foot. Normally the skeleton of foot consists of tarsus, metatarsals and phalanges. Okay, the term tarsus indicates the group of 7 short bones in the posterior part of the foot. So here up to here this forms the tarsus. Okay, so tarsus, how many bones consisting of tarsus? Tarsus consisting of 7 short bones in the posterior part of the foot. That means the tarsus forms the posterior part of the foot. Okay, now we will see how these bones are arranged here. So they are so arranged that the talus articulates. So this one is talus, the 7 bones are talus, and next one is the calcaneum, next navicular, cuboid, and again from medial to lateral it is having 3 cuneiforms, medial cuneiform, intermediate, and a lateral cuneiform. All these 7 forms the tarsus. Okay, here the talus articulates with the tibia and fibula. Okay, articulates with the tibia and fibula, forming the ankle joint. It forms ankle joint, and it articulates above with the tibia and fibula, forming ankle joint, and this one rests on the base formed by the rest of the tarsal bones below. So that means the tarsus, this talus bone is located somewhat above when compared to the remaining tarsal bones. Okay, the talus along with lower ends of the tibia and fibula, which forms the ankle joint, and articulating with the talus on its inferior aspect with the calcaneum. So this calcaneum is the largest tarsal bone. So the entire thing is the calcaneum, and this calcaneum forms the heel of the foot. It is the bone that forms heel. Okay, so this talus and calcaneum are going to articulate to form talocalcaneal joint. What is that joint called? Talocalcaneal joint, which is also called as subtalar joint. Yes, so now we have finished talus and calcaneum, and anterior to the calcaneum and the talus. So this becomes anterior to the calcaneum and the talus will have 2 bones of intermediate size. One is the navicular, which is placed medially. So this is medial side and this one is lateral side. Navicular, which is placed medially, and cuboid placed laterally. Okay, that means this navicular is articulating with the talus. Okay, articulating with the talus, and this navicular is also articulating with the calcaneum on the inferior aspect. So it is forming talocalcaneo-navicular joint. So you can see on the posterior aspect, you can find this calcaneum is also articulating with the navicular bone. So here at this part, you can find some articulation with that of the navicular here. This is the calcaneum and this becomes the talus. This is the plantar aspect. Okay, yes. So what is the joint formed here? By the talus, navicular and calcaneum to form calcaneo-navicular joint. Talocalcaneo-navicular joint. And here, if you can see, this cuneiform only articulates with the top this cuboid, forming what joint? Calcaneo-cuboidal joint. Okay, what is that joint called? Calcaneo-cuboidal joint. So now again we will see the joints. What are the joints formed here? So the what are the bones? Now we have finished. Talus. Below the talus we can find calcaneum, and anterior to these bones we can find medium sized bones called navicular on the medial aspect and cuboid on the lateral aspect, isn't it? So with these four bones some of the joints are formed. So the talus superiorly articulates with the tibia and fibula, forming the ankle joint. Okay, and this talus on the inferior aspect, which articulates with the calcaneum, which forms talocalcaneal joint, which is also called as subtalar joint. So these two bones anteriorly articulating with the navicular, forming talocalcaneo-navicular joint. Talocalcaneo-navicular joint. On the medial aspect we can find very clearly this joint, and on the lateral aspect, so this calcaneum only articulates with the cuboid to form calcaneo-cuboidal joint. Okay, so now anterior to this navicular bone, okay, so anterior to this we can call it as normally distal to the navicular bones. So if you place kept this foot in anatomical position, this cuneiforms falls on the distal aspect. So distal to the navicular there are three small bones. These are called as cuneiforms, individually called the medial cuneiform, intermediate and lateral cuneiforms. Okay, so all these forming joints together. So these joints are called as intertarsal joints. What you call? Intertarsal joints. Okay. And also it forms metatarsal joints with this thing. So it is forming intertarsal in between them, and also intermetatarsal joints. Here we can find anterior to this one we will finish afterwards. So what are the joints formed here? Now we will see. Of course, the joints which are formed between all the tarsals, in between the tarsals, are called as intertarsal joints. So we have discussed the main intertarsal joints, that is the subtalar joint or talocalcaneal joint, and the talocalcaneo-navicular joint, and calcaneo-cuboid joint. These are the main intertarsal joints. And small intertarsal joints which include the cuneiforms with that of the navicular and the cuboid. So it forms cuneo-navicular, okay, cuneo-navicular joint, and cuboido-navicular. So this one, cuboido-navicular joint. So that means the navicular is articulating with cuboid also. These are the small intertarsal joints. Cuboido-navicular, okay, and naviculo-cuneiforms. That means all the cuneiforms. That means medial, intermediate, and lateral. All these articulate with the navicular. That is called as cuneo-navicular and cuboido-navicular, and next one is the cuneo-cuboid. That means the lateral cuneiform articulates with the cuboid. So all these forms the intertarsal joints. Okay. So normally these are all the intertarsal joints. Now we will move on to the other articulations. Here this distal row of this cuneiform and cuboid articulates with the metatarsals. So again, which is same as that of the metacarpals in the hand. Okay, how many metatarsals? Again, it consists of 5 metatarsals. Here the numbering is from medial to lateral. First, second, third, fourth and fifth metatarsals. So these metatarsals which are going to articulate with that of the cuneiforms, okay, cuneiforms as well as the cuboid. And also there are some articulations in between the metatarsals itself. Those joints are called as intermetatarsals. Now we will see in detail about these joints here. If you can see in this pic, so this is navicular and cuboid, navicular and cuboid. Okay, and this one is cuneiforms. One is medial, intermediate, lateral cuneiforms. So now how this metatarsals, first, second, third, fourth and fifth metatarsals are going to articulate with that of the tarsal bones, forming tarso-metatarsal joints here. So now we can see, so these metatarsals are 5 in number, okay, and it is also having a base which is present on the proximal end, and shaft and the head on the distal aspect. Okay, now the head of each metatarsal bone articulates with the phalanges. Okay, and now we will see the articulations of the bases of the metatarsal bones. So the first metatarsal bone, which is having a large kidney-shaped facet on its proximal surface of its base, this face articulates with the medial cuneiform. This articulates with the medial cuneiform. Okay, now the second base of the metatarsal, which is going to articulate with proximally with the intermediate cuneiform bone. If we see medially, it articulates with the medial cuneiform bone, and laterally it articulates with lateral cuneiform bone, and also with the base of third metatarsal, at the base of third metatarsal. Okay, now the base of the third metatarsal bone, the base of the third metatarsal bone articulates proximally with the lateral cuneiform, medially with the second metatarsal bone, medially with the second metatarsal bone, and laterally with the base of fourth metatarsal bone. Okay, now we'll move on to the fourth one. Fourth metatarsal bone articulates proximally with the cuboid bone, okay, medially with the lateral cuneiform, as well as with the base of the third metatarsal. Okay, and laterally it is going to articulate with the base of the fifth metatarsal bone. Okay, now we will see this fifth metatarsal bone articulates proximally with that of the cuboid bone and medially with the which bone? Base of the fourth metatarsal bone. Okay, these are the articulations of the metatarsals with that of the cuneiforms as well as the cuboid forming tarso-metatarsal joints. Now all these heads of this metatarsals are going to articulate with their corresponding proximal phalanges of the foot. Okay, so now we will see in this thing. Yes. Here this first metatarsal is going to articulate with the proximal phalanges. Here also the phalanges are same as that of in hand, that is 14 phalanges we are having. The great toe is having 2 phalanges, proximal and distal phalanges. The remaining 4 toes will have 3 phalanges forming proximal interphalangeal joint as well as distal interphalangeal joints here. Okay, now each metatarsal is going to articulate with their corresponding proximal phalanges forming metatarsophalangeal joints. And if you see the in the great toe, it is forming only 1 interphalangeal joints. In the remaining 4, so all these forming proximal interphalangeal joints and distal interphalangeal joints. So these are the articulations of the foot, and these forms different kinds of joints in the foot. Okay, these are all about the articulations of the foot, and in the next session we are going to start with the new region of the lower limb, that is gluteal region. Thank you.